Well, hello, beautiful people. How are ya? I hope you're having a great day. I'm Dr. Pammy Jean. Fibromyalgia causes a deep ache in the muscle and can be anywhere on the body or everywhere in the muscle tissue. So, when pressure is put on an area of the muscle, it can be excruciatingly painful. In myofascial pain syndrome, there are specific trigger points that cause pain in specific areas of the body. Last week, we discussed tender points. Today, let's discuss trigger points. In this video, I have sectioned it off as Part A and Part B. In Part A, I'll discuss trigger points. In Part B, I'll discuss myofascial pain syndrome and how it affects people with fibromyalgia. There are timestamps in all of my videos, at least over the last 2 years. So feel free to skip around to what interests you. Here we go. Trigger points are hyper-irritable spots in a taut band of a skeletal muscle that's painful on compression, stretch, overload, or contraction of the tissue. It can cause referred pain that is perceived distant from the spot. Acute trauma or repetitive microtraumas may lead to the development of stress on muscle fibers and the formation of trigger points. Repetitive movements that an athlete might perform, or someone who's been in a car accident, for example, may experience trigger point pain. This persistent pain results in a decreased range of motion in the affected muscle. The neck, shoulders, and pelvic girdle are often affected. Regional pain, not widespread pain, results. Trigger points are related to body posture. So slouching in this chair while I'm sitting here talking to you can often result in a trigger point or several, especially when I'm doing research. But any muscle can be affected, such as the buttocks, tension headaches, tinnitus, TMJ, decreased range of motion in the legs. I experienced that. I don't know. I'm assuming it's just part of growing older. And low back pain can be caused by trigger points. I'm starting to have more of that again. That's going right into my bottom and causing pain. I have had an issue with nerves, so let's move on. The muscle will feel firmer than normal and is hypersensitive to palpation, touch. When palpated, the pain in the affected trigger point can radiate to another area of the body close to where it originated, and patients have a local twitch response when pressure is applied. This is when the muscle contracts and usually a dimpling of the muscle and skin occurs along with that twitch response. This often occurs during massage or dry needling. This area is very sensitive, hyper-irritable, as researchers state. Trigger points are quite common in the general population. About 50%, half of us, have an active or latent trigger point or several. Trigger points can be made inactive with the right treatment. There's trigger point therapy, a type of massage. I usually say it hurts so good. That seems to be my general statement with anything that hurts, but I know is good for me because I know those knots that occur in my back, especially, need to be worked out. And there is myofascial release, which can significantly improve symptoms of fibro, such as pain, quality of life, quality of sleep, reduced stress and anxiety, increased range of motion, improve our mood. And all of these things can occur right after treatment. I know that if the massage therapist can't get all the knots out, those trigger points, she'll ask me to come back to get them worked out. I am way overdue for a back massage for sure. And not just my back, she'll work my legs and ankles and feet too, if I would like, and my neck and shoulders, obviously. There are other treatments like physical therapy that can be expensive, and trigger point injections that may include steroids. You can self massage with a foam roller over those tense muscles and those tightened areas, or ask your spouse or friend to rub it over your back because it's kind of hard to do yourself. Are there things that you do that's helped you? Please share it with us below. When the pain of trigger points persists and worsens, even after rest and at-home therapies, myofascial pain syndrome is the result. I'll use MPS for short. Myofascial pain syndrome, MPS, is a common, often overlooked, underdiagnosed condition that carries a significant burden. MPS is often dismissed by clinicians while patients remain in pain for years. I think sometimes people with MPS who do get a diagnosis think that the condition is a psychological one, but that's not the case. Your physician can perform an exam and discuss your symptoms with you. The exam involves pressing gently on specific muscles and muscle groups or tension areas, and will check for active trigger points. Myofascial pain syndrome is a chronic pain condition, not to be taken lightly. It's a common, painful muscle disorder caused by myofascial trigger points, which involve the musculoskeletal system. Common symptoms are the following. This pain often goes away with proper treatment. The characteristics of trigger points are the following. The problem for people with fibromyalgia is that myofascial pain syndrome can overlap with it, and that's huge. Anyone can have issues from time to time with trigger points, but the path to diagnosis of myofascial pain syndrome and fibromyalgia are long and involve pain that can be an 8 of 10 on the pain scale. Normal MRI imaging and ultrasound are found in both conditions. Over the years, quality of life is affected because sleep is also affected. What's the difference between MPS and fibromyalgia? Fibro pain is widespread everywhere on the body. will hurt to touch. In MPS, pain to the touch is localized, or what they call regional pain, but over time, it can travel to other locations. It's believed that myofibroblasts play a role in sustained myofascial tension in connective tissue. Normal fibroblasts are highly sensitive to physical stimuli. Fibroblasts are specialized protein cells in the body essential for the structure of tissues and are involved in collagen synthesis. They are important components of connective tissue that hold organs and tissues in place. Very important. Dermal fibroblasts are involved in inflammation, tissue growth, and repair, as well as wound healing. Scleroderma, a skin disorder, is affected by fibroblasts. Myofibroblasts arise from fibroblasts and possess highly contractible properties like smooth muscle cells. They're highly involved in wound contraction and tissue remodeling. They're not generally present in normal tissue, so their presence in fibromyalgia is of great interest to researchers. Not only does repetitive overuse of muscles contribute to changes found in the fascia, but also a sedentary lifestyle, which will all lead to myofascial pain syndrome because they stiffen up unless appropriate exercise is prescribed. Think of fascia as that covering over a steak, over all the way around it. It's a clear covering. And in humans, it holds muscles together and allows the muscles to stretch. If it tightens, muscles are stiff. There are nerves layered in the fascia, so that explains why it hurts to have trigger points activated. Active trigger points are an issue, but latent trigger points, or those that are not symptomatic, have the same electrophysiologic findings in their sensory nerve fibers. And to make matters worse, you can have both fibro and MPS at the same time. For treatment of MPS, heat to relieve pain, or roll a tennis ball over the trigger point, or use a foam roller to relax and smooth out the tissue. You can take over-the-counter medication like Tylenol, or try yoga or stretching to ease the tension, or find a way to relieve everyday stress. Dry needling and stretching are very helpful. Trigger point injections are often found to be the most helpful, so much so that NSAIDs may no longer be needed. The injection procedure involves an anesthetic and or a corticosteroid into the problem area. This helps to relax the muscles and relieves the pain. Probably hurts to get that done, but the after effect could make it worth it. There's also ultrasound therapy. Didn't know that. Sound waves are transmitted, which heat up and relax the muscle, improve blood flow, and remove scar tissue. It may also reduce stiffness for improved mobility. I imagine that's something you would get at a orthopedic doctor's office or a chiropractor's office. And then I found the prescription wearable device. Massage therapy treatments such as trigger point pressure release reduces stiffness and relieves pain. Stiffness is not sustained over time in males, according to this 2021 study, but it appears that pain is decreased for a longer period of time. So massage therapy can be beneficial. You still for the pain, but you still need to do your stretching and exercising. Most clinicians find that MPS is difficult to treat. The exact location of where the pain comes from and where the referred pain is should be assessed. Unfortunately, myofascial pain and the trigger points involved are underdiagnosed and undertreated. Lastly, since we discussed tender points in the last video, I wanted to show you the difference between trigger points and tender points with this chart. I hope you learned something. I send you gentle hugs and support. Love you.